And now, in a bid to mitigate the effects of the doctors' strike last year that paralyzed medical services in the country, medical practitioners in partnership with Nyeri County government have organized a one-week medical camp targeting patients with thyroid-related illnesses. The patients will undergo surgeries to correct their thyroid glands following procurement of a 5 million shilling harmonic scalpel that is said to be the safest during such surgeries. Our Central Region reporter Raquel Mugai spoke to one of the doctors taking part in the medical charity earlier today, and this is her report.
Provincial General Hospital in Nyeri County, where a medical camp is ongoing in partnership with doctors from this particular institution, as well as other institutions that have come here to try and mitigate the effects that were there during the doctors' strike in the previous years. Now, the patients that are being worked on, the number that is targeted is at least 36 patients. The camp has been running since Monday and it will end this week. And the 36 patients have been targeted, those that are suffering from the thyroid disease. But for this particular medical camp, they're using a different instrument, an instrument that we can say is a milestone in the medical field. It has been used in other parts of the world. It has been used in private facilities, but not in public hospitals. And therefore, that is a milestone for those that will get to visit public hospitals. This particular instrument is referred to as the harmonic scalpel that gets to do a bloodless surgery. But to shed more light on that, I do have with me consultant surgeon Dr. Ndohio Madenge, who is also the surgeon here, and will just shed more light on exactly what difference this particular instrument does as compared to the traditional methods. Thank you so much for joining us here on KTN, Dr. Madenge. Please explain to us what is the benefit of this harmonic scalpel to those that get to undergo the thyroid surgery.
Thank you very much. Just as you have mentioned, we have in the past used the traditional methods to cut. We use either the knife or electricity, an electricity-driven knife. But for years, there is technology that has been available out there, and even in this country, mostly in the private sector, that is, as you've called it, the harmonic scalpel. And from that word harmonic, it actually uses sound waves that are concentrated to the tip of an instrument and therefore can cut. The difference or the advantage that it offers is that it seals blood vessels as it cuts. And therefore, there is that potential to actually do surgery with a minimal loss of blood. And when we are working in the neck, on the thyroid gland, and the neck is the connection between the head, which controls the rest of the body, and the rest of the body. So everything delicate, all the nerves, all the major blood vessels are passing through the neck. And therefore, it's a crowded area, and you want safety. And therefore, the harmonic scalpel significantly improves safety when we are working in the neck. Now, we are really grateful to the Nyeri County government that they managed to acquire the equipment for us, and we now shall be using it, not just in thyroid surgery, but also even in other surgeries. As you said, to reduce blood transfusion, because the less you lose, the less you need to give. And in the end, it is even quite cost-effective, because 1 unit of blood is not cheap. A unit of blood, first of all, is human tissue. It carries risks. But the actual cost of producing a unit of blood can be up to 10,000 shillings. So when you are able to operate on a patient and avoid transfusion, not only are you obviating the risk of transmission of diseases and other risks of reactions from the blood transfusion, but you are also doing a more cost-effective surgery. And finally, that the patient is actually able to go home earlier because they have less complications. Yes.
Talk to us about the thyroid disease. You have been seeing, in our earlier discussions, you have mentioned that the thyroid disease is actually something that's really prevalent, and you get to serve at least 4 to 6 patients in 1 week. And therefore, this kind of, the number of patients that you're targeting this week is also like an year's work. So what really causes this particular thyroid disease, and what is it that, what are some of the signs that probably our viewers can also watch out for to just avoid such scenarios?
Thank you very much. And that is a very good question, because it's important for us to inform the public, something that we probably don't get to do enough. The thyroid gland is a small structure that is on the front part of the neck. And all of us have it, but it only gets to be seen when it is sick. And so the first signs will usually be just some swelling in the neck. Now, for reasons that science hasn't completely explained, it is much commoner in women. And it will start, say, in their early 20s, probably within the childbearing years. And because we know ladies will sometimes gain a little bit more weight, they may see some prominence in the neck and assume it is just the general increase in weight due to childbirth. But we are saying that this should not be ignored. It is important. If you do see some prominence in your neck, it is important to seek medical attention for it. It is also important that those in their family who may have others, especially women, let's say somebody knows their grandmother had a goiter. Maybe one of their sisters or the mother or one of the aunties has a goiter. It is important, if you see some prominence in your neck, to seek medical help for it. It is not cancer. I think it's important to say that by the time we see one cancer patient, we've seen many, many more that don't have cancer. So the symptoms that it causes are actually mainly due to its growth. We said that the neck is a conduit for many critical structures to and from the head, and they get compressed. So that if you see some of the thyroids that we're able to remove here, they are big thyroids. You are getting probably almost 250 grams of a gland that is usually just barely 80 grams. So that swelling will impact upon the lifestyle of that individual. And also on the other hand, because many are young women, they also are disturbed by this growth or this tumor that is in the front of their neck that forces them to wear pull necks that will cover or to wear scarves all the time. And so this is something that can be managed. Yes. And
also, this medical camp, was it free, or how did you and other doctors, and also the team of doctors that totals about 15, how did you get to go about this and make sure that at least all the patients that required this particular surgery were able to get it, and especially now with the use of the harmonic scalpel?
Okay. The Surgical Society of Kenya, in its annual general meeting last year, recognized that the year 2017 was a tumultuous year for the medical profession. There were many strikes of the different cadres of health workers, and therefore many patients needing elective surgery. This is the non-emergency surgery, did not get the care that they needed. So when we looked at our books, we found that we had actually about 40 patients who needed this surgery. But this time now, those who could come to benefit this week are 36. So in our region, that is what we recognized as a problem. And therefore, we called in the surgeons in our local Surgical Society of Kenya chapter, the central chapter. And they have been very supportive. So this week, I have surgeons from Laikipia, I have surgeons from Muranga, I have a surgeon from Embu, and I have the local surgeons within Nyeri who have come to team up with us, just the local surgeons. Then I also now was able to get in a thyroid surgery expert from Kenyatta National Hospital and 4 other young surgeons from there. I have surgeons from Aga Khan Hospital. I have surgeons from Mata Hospital. So it's been a wonderful collaboration of the local doctors to make this a success. Yes.
And probably do we expect more of this medical camps targeting probably different patients who suffer from different diseases in the years to come or even months to come?
We expect to do that. One of the mandates of the Surgical Society of Kenya is to be an advocate of the surgical patient and also look at the need wherever we are as surgeons, in whichever region of the country, because needs will differ. The needs of the population in Nyeri County are not the same as the needs in Marsabit County. So people will need to look at their areas, and this is what now we are doing. So we expect that even in other areas, there will be surgeons there doing exactly the same. And even us, because we have been assisted here, we will be willing and able to go and help in other areas as well.
Yeah. Thank you so much, Dr. A really great camp for those who require this particular surgeries. And just as Dr. Mathenge has mentioned, is that this is an elective surgery, and therefore with them getting to team up with the Surgical Association of Kenya just to get to mitigate the effects of the doctors' strike that paralyzed health services in the country, this particular medical camp will get to assist at least 36 patients who would have otherwise been seen within a span of 1 year. And therefore, as he has mentioned, is that we do expect that such kind of camps will take place in other different regions. But what I can see from this end is that it has been an interesting time for me getting to experience a 2-hour surgery where they get to have this particular surgery where there is no blood, given that in a normal occurrence is that when people think of surgery, you think of blood. And therefore, this is a really great thing, and we do expect that more will be happening in
Raquel Mugai.